Dr. Scott Glidden from Select Pain Care here at Badger CrossFit, and Tyler and I have decided we're going to make a couple of really great videos for you guys, just so you know more about what's going on with some common problems that are going to lead to chronic injuries. Because here we're all about trying to eliminate those injuries and still be functionally fit, look good naked, all those wonderful things. So I'm going to be dragging Tyler in, and we're going to go over the front rack today. Now the front rack is something you need in most Olympic lifts here, and really it's a great thing to have for almost anything. So if you're even pushing stuff over your head, you're putting the box in the garage, it's good to have that ability to do it properly. So if you do have a good front rack position, here's what it's going to look like. Those elbows are coming out at 90 degrees. You can pick, your fingers are clearly around the bar. Maybe you can even grab the bar. This would be ideal. If you can do this, it's very likely you're never going to have any problems with front rack. You're not going to have a shoulder problem. You're not going to have wrist pinching. You're not going to develop a back problem from doing these Olympic lifts because you have full function. The trouble is, many people, when we talk about, oh, I have this problem when I clean or do these things, you place the blame in the wrong places. One of those is the shoulder. And they'll say, well, my shoulder just can't get there. I just need to foam roll the crap out of it beforehand and I'm going to be better. But here's the reality of it. It's not a shoulder problem. Here, if you could rack this for a second. The only thing being challenged here is your forearms. If we take the forearms out of it, if you just raise your arms up to here, you're doing essentially the same thing, right? So if your arms come up to here and you're about even with that front rack position and you have no pain here, guess what? Your shoulders are not the problem. It's your forearm flexors. What happens is we end up overusing these tissues. They get very inflamed. Your body's response to inflammation is saying, hey, body, something bad's happening. If this continues, I'm gonna tear, and we don't want that. So in comes stuff called adhesion or scar tissue. It's gonna act like glue and stabilize the tissues. However, now that it's more stable, you lose a little range of motion and you lose a little bit of strength. So where you were once able to maybe get through this workout and you don't have any burning or aching, now you're getting a little bit of that. Maybe you're losing a little range of motion. Maybe you're getting a pinch in the back of your wrist. Those are signs that there's this glue-like stuff on your muscles that are limiting your function. And when you have lots of dysfunction here, you're gonna have pain. But there's other things we need to look at first, because getting rid of adhesion is difficult, and it's not something you do on your own. So let's figure out all the stuff you can do on your own right now. So the first thing we need to do here is this forearm function test, and Tyler's gonna show you exactly what you need to do to figure out how much function you have.
All right, so what you're gonna do is you're gonna place your hand away from either a door jamb or here at the gym, obviously we can use one of the upright rigs and the poles to be able to do this test. You place your hand, ladies, 5 inches away from the door jamb or the rig in the gym, or gentlemen, 6 inches. Okay, that's going to be the longest point. So the middle finger, place at that mark, 5 or 6 inches. We're going to keep our arm completely locked out here at the elbow. All right, we're going to pull that shoulder down and back. All right, we don't want to be elevating that shoulder blade or the shoulder girdle. Pull it down, keep it tight back there. Keep your arms straight, hand all the way completely, everything on the ground. Nice and slow until you can get close to the rig. Now, this would be a pass, right? If you're out here, that's a fail, right? Where you're not touching it. The other thing too, fail, if you can touch it, but your wrist lifts up, okay, that's a fail. Or your fingers lift off the floor. If you can't keep your fingers flat on the ground, that's also a strain, that would be considered something to look at.
So one common thing, as I just talked about, was that pinching you'll get, or maybe tension in here. What's happening here is that if these tissues aren't able to stretch out, they're going to close down the joint space. So instead of being able to stretch out and get that nice full range of motion where that shoulder can touch, the tissues are going to pull tight early due to this adhesion, and your body's going to have to borrow range of motion from the joint space. So what will happen is the tissues won't stretch here, and they'll close down this part of the joint space here, which is why you often get a pinch. If you're in a plank position, you'll get a pinch there if you're loaded up with a bar in the front rack position. So what's something we could do? What would be a good warm-up that could be done to maybe prevent some of this, or maybe get a little extra range of motion for a lift before you get started?
Yeah, good question. So I think a lot of times when we do something that requires a lot of wrist range of motion, just even the drill that I just performed here is something we can also perform. You don't have to go against a rig for it, but you can place both hands on the floor, right? Put some weight into that position, and you're just holding and stretching things out. Okay, that's always a good one to spend. You can reverse that as well. Okay, keeping your palms on the ground, straighten things out, right? And do the same thing the other way. All right, being gentle on both sides. That's usually what we would do and recommend for. There's really only two ways your wrist goes. So.
You could also add in that finger flexion here. So we're being a little more dynamic with it, where we're actually loading those tissues and you're getting a little extra blood flow. Because if you sit too long in any of these static stretches, you're actually going to lose up to 20% of your performance. That's going to go for your hamstrings, that's going to go for anything. Any warm-up should be a dynamic movement. So leg swings, butt kicks, something where you're actually getting the blood flow, rather than like, I'm going to sit into this hurdler's lunge and let my blood pool and calm down. So it's all about that dynamic beforehand and then a nice cool down afterwards. That'll help pump out some of the inflammation that's there and really help you recover properly, because at the end of a workout, you aren't stronger. You're just beat yourself up. It's a matter of how you recover from the workout. That's going to decide whether you're turning this into usable muscle or you're going to end up with slowly building chronic injury.